Yeah.
Ready to rock and roll?
That's gonna happen.
Yep, sounds great.
We have three additional guests online: Austin, Christoph Jenkins, and TJ Northwood.
Excellent. All right. It's a little bit after 7. I want to welcome everybody to our first listening session as it is for the joint EMS paramedic program that we are proposing, that we've been in the works having in the last couple of years, thanks to the hard work of a bunch of different individuals, some new hires for the paramedics that we've had over the last year and a half, and some grant dollars that have since been awarded through the county to get this whole thing started. So the whole purpose of being here today is to really hear your thoughts, anybody that's here in the audience, as well as anybody that's online listening on Zoom. For those that are listening and following along on Zoom, we will have a presentation. You can see that right now on your screen. If you have any questions, we will be monitoring the chat and answering those as time goes on. So feel free to pipe in with those. And again, this is meant to be more of an informal meeting. This is not us up here dictating what happens. The one thing I will say is we will follow some decorum. We're not going to get into a situation where we're going back and forth and insults won't be tolerated, things like that. So let's just all keep it clean and nice and friendly. And then if there are any questions, like I said, of anybody at any point, please feel free to, come up to the microphone if you want to, or just blurt them out. That's not a problem. We're going to start off with a presentation by our fire chief. And I believe that Christoph Jenkins, the administrator, will pipe in at some point with it.
Yes. Yep.
Okay. So we'll start off with a presentation from Chief Weicker and go from there. Stage is yours, sir.
So I'm going to start out with just a little bit of history of where we come from and where we are today. So pre-1974, our EMS services were provided by Ozaki County or Port Washington Fire Department. Volunteers were based out of Port Washington mainly. In 1974, we had Northern Ozaki Ambulance that was formed here. That was done by local volunteers. And that was to cover the needs of the EMS services for the town of Fredonia, village of Fredonia, town of Belgium, and village of Belgium. In 2000, the Fredonia Fire Department and Northern Ozaki combined together to form the Fredonia, to be underneath the Fredonia Fire Department. We had the same building, we had the same members. It just was foolish that we were running two different businesses or two different pieces out of the same building with the same members. So it required double the training, double the meetings, and we just went down that path with the merger there. So some required certification levels for our ambulance. So we have three different levels of certification that we're running with. We have an EMR, which is emergency medical responder. The initial training for an EMR is 56 hours at Lakeshore Technical College. The additional testing there after you pass the class of the National Registry, and then also passing our medical director's protocol tests that we do there. Emergency medical technician is the next level up. Current training hours at MATC are 180 hours plus 12 hours of clinical time. The additional testing again, passing the National Registry, and then passing the medical director's test on skills. And then an advanced EMT, advanced emergency medical technician, prerequisite for that is the 180-hour class above and passing that. And then training hours, additional training that is taken for the advanced level is 120 hours at MATC with 20 hours of additional clinical time. And again, passing the additional testing of the National Registry and our existing medical directors. Now, with that, once you pass that, then there is a renewal certification every 3 years. Now, the state was every 2 years, but they just recently went to 3 year, so a triannual recertification. So EMR is your CPR renewal, which is due every 2 years, which makes it a little confusing. And then 18 hours at MATC or LTC, or local protocol training, or through our medical director. EMT, emergency medical technician, CPR certification again. And then every 3 years, we have 30 hours at MATC or LTC, and plus some local protocol training, or through our medical director. And I'll explain the medical director piece on the bottom. And then we have advanced emergency medical technician for our recertification there. We have the CPR again, 48 hours of MATC and LTC training, and then plus local protocol training, or we can go through medical director as well. When I talk about the medical director piece of it, that is doing our training and our recertification in-house. We train every once a month for 2 hours at our station. It is education and stuff provided by our medical director. And the benefits of that is that our staff, our volunteers don't have to go to a weekend class at a technical college and use up their weekends on that. So we use it on our normal training nights, on Tuesday nights. It covers a state requirement, and it also brings out the local protocols that we have to follow. So our ambulance staffing requirements. The Wisconsin Department of Health Services, for the advanced level care ambulance provider that we were, the minimum staffing requirements are 1 AEMT or 1 advanced level EMT, and then 1 AEMT, EMT, or EMR. Any combination of those makes a legal crew in the state of Wisconsin. The Fredonia Fire Department ambulance, our staffing levels are 24/7 coverage, and we provide 1 AEMT, 1 AMT, EMT, or EMR, and then a driver. We add a driver into that. That allows 2 skilled people to be back working on the patient. Our volunteer numbers in 2017, we had 17 EMRs, EMTs, AEMTs. We had 11 at the AEMT staff level. And I'm highlighting those because I'm going to come back to those highlighted ones. In 2024, currently, we're sitting with 15 EMRs, EMTs, or AEMTs. 8 of them are A-level EMTs, advanced level EMTs. And then we have 10 drivers. A little bit of our volunteers and their location of residence. Not everybody is from the village of Fredonia. So our EMTs, EMRs, we have 6 of them that are from the village of Fredonia, 2 from the town of Fredonia, 4 from the town of Saukville, 1 from the town of Belgium, and 2 of them that are further away. For our department membership as a whole, we have 15 people that are from the village of Fredonia, 5 from the town of Fredonia, 9 from the town of Saukville, 2 from the town of Belgium, and 4 that are farther away. So just kind of a layout there of what the geography is of where these volunteers are coming from. Call volumes. In 2014, our ambulance call volumes were at 232 for the year. As you can see, we've had an increase every single year. This year, in 2024, we're projected to be at 456. In 10 years, we have doubled our call volume. And our numbers, our volunteers keep on going down. So here's where I'm going to bring back into that, up in the upper right-hand corner, the Wisconsin Department of Health Services, talking about what the coverages all needed to be, with one AEMT always being on duty at all times. In 2017, we had 11 AEMT staff with a 24/7 coverage, call coverage that we need to do. Each one of those A-level EMTs had to provide 797 hours of on-call time annually for us. And then run 274 calls with those 11 people. In 2024, with our current volunteers, we have only 8 A-level EMTs. 24/7 coverage, that puts us at 1,095 hours of on-call annually for our A-level, for our advanced level EMTs. This is in addition to, I need everybody to understand it, this is in addition to their 2,080 hour a year jobs that they're doing, because they are all volunteers. They all have other jobs. And this year projected to be 456 calls. So a little fire and EMS program history. This is not something that this paramedic program or upgrade of service, hiring staff is nothing that just came out of the blue here in the last 2 months. We have been working on this for over 4 years. In 2020, the Wisconsin Policy Forum did a study. It started a study of Ozaukee County fire and EMS system. So it was completed in 2021. The study noted the following. Items that are taxing our fire and EMS service. The #1 problem that they listed in there was the lack of volunteers. Ozaukee County is, or was at that time, 95% volunteer-based fire and EMS. We have an aging population. Everybody hears that, everybody sees that. That is also taxing the EMS system. And the number of assisted living units and nursing home units in our communities is adding to the call volume that we're seeing here. It's something that is needed in the community, but it also has a reaction here of more calls as the population's aging. Our EMS status in 2020 for the county, we had 4 paramedic ambulance services in Ozaukee County. We had Grafton, we had Mequon, Port Washington, and Thiensville at the time. We had 4 advanced level ambulance services in Ozaukee County. We had Cedarburg, Fredonia, Saukville, and Waubeka. And we had 1 non-ambulance provider in Ozaukee County as a fire department, and that is Belgium. And that's Belgium is covered by Port Washington and Fredonia for ambulance service. So the notes at the end of the summary of the Wisconsin Policy Forum study was collaboration is needed to sustain both fire and EMS here. They recommended some form of full-time staffing between Fredonia, Belgium, and Waubeka in order to sustain the fire and EMS services up here in this part of the county. There was lots of different, with this Policy Forum report that came out, there was many different ideas. One complete fire department and EMS service for the entire county, everybody all underneath one umbrella, a north and a south. They divided it into thirds. And so lots of different ideas there. And so with that, in 2021, shortly after that study was out, we had, at that time, Ozaukee County Sheriff Jim Johnson approached the Ozaukee County Fire Chiefs. Specific to the EMS response time that he had concerns about. He noted specifically a call in the village of Belgium where paramedic level service took over 20 minutes on scene time. We relied on that call specifically, we relied on a paramedic unit from Thiensville due to the availability in the rest of the county. Port Washington being out, Grafton being out, Mequon wasn't doing paramedic intercepts or anything like that. So we had to rely on Thiensville. So a paramedic was coming from Thiensville to get to that call. So Sheriff Johnson brought it up. We had the chiefs all in a meeting in his conference room down at the Sheriff's Department. Ozaukee County, he told us Ozaukee County ARPA funds are available to assist with this problem possibly. So he planted the seed with us. The Ozaukee County Fire Chief decided that firefighter paramedics were the solution. Serves two purposes. It provides paramedic service for the northern third of our county, which we didn't have at the time. We were relying on other communities to provide that service for us. And it sets our departments up with personnel for the future. These paramedics are firefighter paramedics that we hire. So they're trained in fire, they're also our paramedic level. So it sets our department's fire personnel up for the future needs that we'll have. In 2021, late 2021, Ozaukee County Fire Chiefs approached Ozaukee County Board for funding. It was unanimously approved. They unanimously approved the grant program. The funding was obtained from Ozaukee County. The requirements for that, it had to be a collaboration between communities. It had to contain an approved sustainability plan beyond the county funding, not something where we were to get the funding and then let the paramedics go and the program would be scrapped. Ozaukee County funding also must be spent by December 2025 because it was ARPA funds. So in 2023, there's a big gap between late 2021 and 2023. There was a lot of meetings with Ozaukee County Board, Ozaukee County Public Safety in order to iron out all the details that were there. But Fredonia received a total of $648,000 in grant funding from the county. This allowed us to upgrade our Fredonia ambulance service to level of paramedic. The grant supported $1,000 in equipment needs, so which left us with $548,000 for wages and benefits. The grant was to provide funding of full-time staff at the firehouse. The grant was to provide funding of full-time staff at the firehouse through December of 2025. Joint municipal agreements, MOUs, memorandum of understandings, were approved and signed by the municipalities, those 4 municipalities, the Village of Belgium, the Town of Belgium, the Village of Fredonia, and the Town of Fredonia. So in June of 2023, we hired our first firefighter paramedic. He's sitting here tonight, Josh. Josh has been with us since June of 2023. We have another firefighter paramedic that was hired in October of 23, Crystal. And then in May of 2024, the joint municipal meeting approved us hiring a part-time firefighter paramedic, and that is Dean, who is here with us tonight as well. So the current status, we have firefighter paramedic staff. We have 2 full-time, 1 part-time. Fredonia Ambulance is providing currently paramedic level care with paramedic level ambulance service to the Village of Fredonia, the Village of Belgium, parts of the Town of Fredonia, and parts of the Town of Belgium. And we are also providing paramedic intercept service to Wabiga Fire Department ambulance right now. Ozaukee County funding is estimated to fund this through approximately August of 2025. The joint municipal agreement between the 4 municipalities approved us to fund the part-time person and to get us to fund the deficit that is going to be coming in late 2025 of the funds that we receive from the county. Those are estimated to be running out around August of 2025. The joint municipalities all agreed to fund that through the end of 2025. We're currently working through funding of 2026 and beyond. It carries a price tag of $510,000 annually. And the referendum is projected to carry us through 2036 for paramedic level ambulance service in the north end of the county. So fire medic positions. Fire medic positions fill 1 spot on a 3-person ambulance crew for Fredonia. The state of Wisconsin, again, 2-person ambulance crew is legal. So we do 1 paramedic and then 1 of our EMTs, or EMRs, any combination of them. We do have a full-time advanced level EMT that works for us Monday through Friday from 7 o'clock until 4 o'clock every day. That full-time position was established in 2017. We did have, prior to that, we did have 2 part-time advanced level EMT positions that were in place pre-2004. That position, the AEMT position, is funded by call revenue and by per call fee that is charged to the municipalities that we serve, village and town of Belgium. With an in-station paramedic, now we have a legal crew at the station Monday through Friday from 7 o'clock in the morning to 4 o'clock in the afternoon. Volunteers fill the other 2 shift openings. Again, current staffing levels, we have 13 firefighters or drivers. We have 18 EMTs, EMRs, and EMTAs. So what does that mean? That 487 of on-call hours. Remember I had that number out there before of 1,096 hours that our AEMTs had to do? That now has dropped down to 487 hours if we get a paramedic on all the time. That's huge. That's less burnout. We won't have the turnover that we have when people get tired. You can't be on call that much and take time away from your family. So, yeah, that was hiding there. So the 8 EMTs and the 1,095 hours. So with our current staffing levels with the paramedics, we're currently staffing about 60% of the paramedic schedule. We are doing this through a program that the state has called Flexible Staffing Plan, which allows us to go on and off of paramedic level care for our communities. Coverage to improve as 2024 closes out with the addition of Dean being added to our team here in May of 2024. Dean, as a part-time paramedic for us, is allowed to put in 1,196 hours annually on a rolling year, not calendar year. And that would mean the same thing for any other part-time people that we hire. Call volume coverage, some call numbers through July 31st of 2024. We have had 137 total paramedic level incidents. And that is done, the way we record those numbers is through how those calls are dispatched to us. Ozaki Sheriff's Department has a thing called EMD, Emergency Medical Dispatching. Their dispatchers are trained. They run through a series of questions. Some of you may have called 911 and wonder what all the questions are about when you call 911. They're critiquing your call to let us know what level of care we need to have there. So that we get told it's a rescue 1, 2, or 3. The paramedics are leaving immediately in a vehicle and responding to the call. They aren't waiting for the ambulance crew to show up and go with them. If it's a 4 or 5, the paramedics have the ability to critique the call, listen to what it is. If there's potential for a serious call, they head out. EMD is not always 100% correct, but it's their judgment then. But the 1s, 2s, and 3s, they head out right away and take off. So 34 paramedic level incidents so far this year have been outsourced. I could say outsourced, or we get mutual aid for them. And that is from Port Washington, Saukville, or Grafton fire departments that we ask for them to come in and provide care to our patients when we haven't had a paramedic on. 18 requests for paramedic level intercepts. So we had 9 incidents through May 31st. And the other 9 came from June 1st to July 31st. We have rolled the dice, and we have staffed 76% of the paramedic level incidents. That is a good number, but that is gambling. I approached the joint municipal group that is together with the town of Belgium representatives, the town of Fredonia representatives, the village of Fredonia representatives, village of Belgium representatives. And they all felt the same way when we only had Josh and Crystal there for us. I said, my luck, I need a paramedic, and they're not going to be on. That is my luck, and I think there's a lot of people in here that'll say the same thing. That'll be their luck, right? If we need the paramedic, we need them to be there. So they all approved that we would move forward with getting Dean hired, get another part-time one in to help us shore up the staffing levels a little bit better. This is the most impressive slide that I think sells me on this program, is our response times. It's only going to get better as we get more paramedics here, and we get full-time people in there. You can see the town of Belgium. So 2022, I don't have the details of breakdowns of what all the municipalities were, because we didn't record the data at that time, that specifically. But look at our all the calls combined in 2022 for EMS. We're at 13.9 minutes in response time. That's from the time we get notified, the page goes out until the time that we are at the patient. 13.9 minutes, that's huge. Now take that number and move to 2024 at the end of July, 9.98. That is all of our calls. That's a 3.92 minute differential. We dropped that amount, almost 4 minutes less in response time. That's huge. And like I said, it's only going to get better. You see what each one of your municipalities are there. Again, this slide is huge when it comes to life-saving efforts. So fire medic benefits, full-time fire medic position takes the load off for volunteers, as it is one less spot on the ambulance schedule to fill. A full-time fire paramedic will significantly reduce the response times, as you just seen, and ensure the ambulance is staffed consistently. First response vehicle, I talked about that. The first response vehicle is a Ford Explorer. It's fully loaded with the equipment and medications that paramedics need to treat patients. We get a call in Belgium for a heart attack, chest pain, comes in as a rescue too. The paramedic is in that vehicle and leaving immediately. Our ambulance will follow with a driver and an EMT. They'll follow, get down there, but that paramedic will get there as quick as he can to start administering the medications and stuff that he needs to. Providing you with the highest quality qualified medical providers in the pre-hospital world, in the pre-hospital setting. So outside of the hospital, paramedics are the highest level of care you can have. They can provide numerous life-saving interventions and administer medications to manage pain, ease suffering, and provide comfort. Paramedics provide more advanced airway management procedures, not downgrading our advanced level EMTs, our EMTs, or EMRs. They have lots of skills. They have more skills now than they have ever. They are doing things out in the field that you couldn't imagine them doing out in the field what they do. That should be done in the hospital in my eyes, but capabilities to quickly and effectively treat multiple medical emergencies, including asthma attacks, COPD, choking, anaphylaxis, and many others. Treatments may include intubation, cryotomy, CPAP, breathing treatments, and the administration of various medical level medications. Paramedics also carry a high skill level in the treating of conditions related to the heart. This includes heart attacks and potentially dangerous heart rhythms. Paramedics can administer medications and perform other procedures to treat these conditions. These are life-saving interventions that can only be done by a paramedic. In the absence of a fire medic, Rhone ambulance response times will increase significantly. You've seen that on the chart in the back. We end up providing a lower level of care to the community than what is expected. We would rely on surrounding communities for a paramedic. The delays will be higher for the level of care that to provide to our patients, and it's been historically inconsistent. With a paramedic, we are putting our residents' lives without a paramedic, we are putting our residents' lives at risk by delaying possible life-saving interventions. With the lack of volunteers, you're talking longer response times. We'd be going back to the 2022 times that are out there, or possibly even longer. Waiting on mutual aid for an ambulance potentially because volunteers are not available. Other community systems are taxed as well. In the lower right-hand corner, we had Crystal was on. We had 2 incidents within 24 hours where patients were provided life-saving measures, and one of them is alive today because of that. That is priceless. That's priceless. Crystal got off a 24-hour shift, and I texted her and I said, "Great job," because I knew the outcome of 2 of them, of both of the patients, and a great job. And she said she quits. You know, it was a rough 24 hours for her. It was 2 serious calls. Both of the patients coded, but she was able to bring both of them back, and one of them is still alive today because of that. So that's a priceless thing right there. You guys are going to go through this. Josh, you want to talk with this? This is the medic skills. They're going to have some added things in here that you can talk through.
Sure. You wanna come on
Yeah,
here and
yep.
tell me, it's all recorded, everybody can. Introduce yourself for the.
All righty, I'm Josh, firefighter paramedic for Fredonia. I've been in EMS for about 13 years, and all of that has been pretty much in this area. This is just a couple of our skills. So for airway, the cricothyrotomy, there's two types, surgical or needle. Surgical is where we use a scalpel to basically make an incision to the anterior portion of the neck, to the front of the neck. And then we put in a breathing tube through their neck so we can breathe for them. This procedure we do in the field. The only other people or professions that do this procedure are doctors. It's paramedics and doctors, and that's about it. And most doctors don't even do it. So it's mostly paramedics and some doctors. Needle cric is where you place a needle through the anterior portion of the neck. Usually this is done in kids that are choking, have a severe allergic reaction. And we actually have a sort of device that it's called a jet ventilator that we stick a needle into a child's basically neck. And then we attach our jet ventilator and that provides them with oxygen. Intubation. So this is probably what you'll see on like TV shows where they're, you know, someone's not breathing, they stick that breathing tube down their mouth immediately without even looking. It's not super realistic when you see it on TV, but that is something we can do. Again, that is paramedics and doctors, and that's it for that type of skill. We got a mechanical ventilator from the state for free. Ventilators can be anywhere from $20,000 to $60,000. We got one for free from the state because they had a surplus after COVID. So we got a free ventilator, which is awesome. It is not in service yet, as there is a ton of training and a ton of protocols to write in regards to that. But what we can do is set up this ventilator. I can plug in some settings, attach it to their ET tube. That's that innovation, and it breathes for them automatically and the most efficient way possible. Again, that you're only pretty much going to see that in ICUs and hospitals, sometimes in the ER as well. So for the heart, we can do a skill called cardioversion. This is where we put pads on their chests. Oftentimes, this patient is in a lethal heart rhythm. You know, maybe you've heard of the term BTAC or AFib or A-flutter or SVT, different super fast heart rhythms, heart rate, you know, pumping out of their chest. This can lead to death. Obviously, your heart's not working well, you're going to die. We can do what's called cardioversion, which is an accurate shock to the heart to a live patient. Shocking a patient with pads is not only when they are deceased, it is also when they're alive and in a lethal heart rhythm. So we can use those down there, the EKG 12, 15, and 18 lead. We'll do one of those. We'll then diagnose your heart rhythm. We'll either provide medications or cardioversion to correct that. Again, that is a very specialized, and we're doing that. I've done it in the back of semi trucks. I've done it in basements and bathrooms and wherever. So defibrillation, that is probably what you're more used to seeing, again, on TV shows. The clear, you know, throw it on their chest and shock them. So we are, of course, able to do that manually, meaning, you know, we might have an AED around here. Okay, out in the hall, the AED you throw on and it walks you through it, right? For us, I can look at my monitor and say, that's a rhythm I can shock, I'm shocking. Or that's not a rhythm I can shock. Don't worry about the AED, we're just doing CPR. So I can accurately diagnose their heart rhythm to see what is best for the patient, instead of having to listen to the AED, try to tell you what to do, which wastes precious time. The EKGs, I imagine most people have heard of EKGs. We do several levels of EKGs, and we can diagnose heart attacks. With EKGs, I could also tell if your potassium's high or low, your calcium's high or low, your sodium's high or low. If you're having a pulmonary embolism, if you are, again, in a lethal heart rhythm, if there's blocks in your heart, I could tell you a dozen things about you just from your EKG, and do it in the field and then treat it in the field. Transcutaneous pacing is, again, we're using those pads. If your rhythm is super slow, we can deliver electric impulses to tell your heart to beat. So too fast, we can shock it, reset it. Too slow, we can throw on this pacemaker, basically. A lot of people have internal pacemakers. This is an external pacemaker, and that's something we can do as well. Valsalva maneuvers. This is to slow down the heart rate, and anyone can do this. And we get a lot of calls for people accidentally doing it to themselves. This is called vagling down. And this is when, if you bear down a lot, if you're trying to have a bowel movement, or if you hold your breath and bear down, or you try to breathe through a straw or something like that, your heart rate will decrease. And I'm not going to sit here and waste time explaining how that happens, but that is something we can do, and you can do on yourself. If your heart rate's beating out of your chest, you could try to bear down or breathe through a straw, and it should decrease a little bit. Still call 911 though. Administration routes, we can actually, through that breathing tube, we can put medications through that breathing tube. So we'll put medications, fluid directly into your lungs. It doesn't sound pleasant, and it's not, but sometimes it's necessary. We can also do rectal, again, not very pleasant, but sometimes necessary. IV fluids, there's several different IV fluids to treat dehydration, to treat different medical emergencies. One is sugar. What are you doing, Kyle? But yeah, so diabetics with low blood sugar, oftentimes they're unresponsive. We get on scene, we throw in an IV, we give some D10, some sugar. Within minutes, they're talking to us just fine, and they don't want to go to the hospital anymore. From unresponsive and a true medical emergency to talking and completely fine in minutes. Other medications, adenosine, I won't go through every single one, but adenosine, this is going to restart your heart. Other antiarrhythmics, amiodarone and lidocaine. Again, these abnormal heart rhythms we can treat the same way they would in the hospital. We can treat it in the field. Atropine, this is to speed up your heart. Lidocaine, antidysrhythmic. Magnesium, antidysrhythmic. Also used in eclampsia. Eclampsia is when you get super high blood pressure during pregnancy and have seizures. We can treat that. Magnesium is also, again, an antidysrhythmic. We carry fentanyl for pain management. Fentanyl is one of the most potent painkillers there are. A lot of people don't use it very well, but we do, and it is very effective when used correctly. Sodium bicarb, vasopressor, we have epinephrine and we have norepinephrine. If your blood pressure gets super low, you go into shock, we can give a vasopressor. Same thing they would do in the ED, in the ICU. We can do that in the field. And we have IV pumps to ensure that we are giving the exact correct dose. Same thing in the hospital. Calcium, diphenhydramine, aka Benadryl, racemic epinephrine. This is for your children with croup cough. So croup and epiglottitis. Croup is inflammation of the upper airway in kids. We can give racemic epi via nebulizer, like a breathing treatment, in order to treat that. So again, severe respiratory illnesses in children that can quickly lead to death, we can treat within minutes of you calling 911. Ketamine. Ketamine is another super fun drug that people use recreationally. This can treat pain. This is also a sedative. So there's some terms, of course, psychosis and excited delirium and different things where people are out of their mind. I've showed up on calls where there's 7, 8, 9 police officers all battling a patient, and I give my ketamine real quick, fast asleep. Very safe, and keeps our police officers safe, keeps our responders safe, and keeps the patient safe. It's also great for treating pain. Versed, this is a benzo, which is a sedative as well and treats seizures. Again, norepinephrine for low blood pressure.
No. Thank you, Josh.
Of course.
As Josh said, talking about the airway treatment specifically to cricoid, stuff like that, I mean, that is obviously extremely time sensitive. I mean, that's where there's a complete airway blockage from the choking, so if we're waiting 20 minutes for another agency to come, another paramedic agency from outside the area to provide that service.
It's a newer guy.
Yeah, so that's really dependent on quick response.
Yeah, we had a choking on Highway 57 pretty recently. Luckily, they were able to kind of get it out, someone provided the Heimlich maneuver. But that's a situation, I happened to be by the gas station, I was there within 2 minutes. If it was a full occlusion, I could have performed that if need be within 4 minutes of them choking, which is incredible. Instead of waiting for up to 20 plus minutes, where 20 minutes without oxygen, you're not going to.
So our firefighter paramedic plan for the future, currently 2024, we're sitting with 2 full-time, Josh and Crystal, and we have 1 part-time Dean. In 2025, 2 full-time, Josh and Crystal, and then part-time, we have Dean, and then we would add 1 more part-time position, so 2 part-time there. And then 2026 moving forward, when the funding will be needed from municipalities to support this and sustain this, we need 3 full-time firefighter paramedics, which would mean adding 1, and then adding another additional part-time paramedic. So we'd have 3 full-time, 3 part-time to staff us 24/7. Christoph, are you on?
Yep. Can you hear me?
Yep.
Great. Well, thank you so much for letting me hop on here. I'm actually standing in the middle of Stephen Foster State Park, Florida, taking a little break from the vacation to meet with all of you. So huge thanks to my wife, who has a lot of patience for me and my job. So I'm just going to touch on the next couple slides that talk about the expenditure piece. So as was alluded to, by 2026, the goal is to have 3 full-time and 3 part-time paramedics, and the cost of which obviously comes with a cost. So you see a breakdown of what those expenditures are. Much of it is payroll, wages, health insurance, Wisconsin retirement system, and Social Security and Medicare payments. In addition to that, we have ongoing medical supplies, training, uniforms and gears, and then maintenance for our vehicles, general insurance for all of the different pieces of the operation, and then a portion of the chief's wages. So all of this rolled up in 2026, again, assuming we hire the 3 full-time and 3 part-times, that gets you to about $510,000 that's needed to support the program. Then underneath that, you see capital expenditures. We had a couple of capital expenditures that the chief discussed already as far as the vehicles that were needed and with startup costs. In addition to that, there's a planned capital expenditure to build out sleeping quarters in the Fredonia Fire Department station. Obviously, as we have the staff there running 24-hour shifts, they need places to sleep and accommodations. So this does that build out. One thing to note is that we're doing it next year while the ARPA grant dollars are still a party to this. So that's helping to cover those costs. Beyond that, you'll see a $17,000 roughly annual kind of us putting away, saving for a rainy day that is meant for the replacements of the defibrillator and the intercept vehicle. Again, both of those were items that we just purchased within the scope of the grant, but eventually will need to get replaced, and that's why we're setting aside those dollars. We were asked by our financial advisors to look in the future, right, of what these costs could be. We attached different escalators, and on average, it's about a 5% increase in cost year to year to operate this program. So if you want to go to the next slide there.
Okay.
So the way that the joint municipal agreement works is that it takes this cost, so it's roughly $520,000, $530,000 expenses, and splits it up amongst the 4 municipalities. And we do that equally weighted amongst call volume, equalized value, and population. In the original discussions with the joint group, we originally thought, well, maybe we're just going to track call volume. But then we discussed about, well, what if one municipality grows faster than another, right? What if one builds a senior home all of a sudden and we have increased calls? So these 3 weighted measures were meant to capture pretty much all the variables that might come up on a year-to-year basis. And these items are reset each year, so the formula might change. It might ebb and flow little by little. So as of 2026, assuming all the variables stay the same, of that 530,000 that we talked about, 175 of that cost would be the Village of Fredonia's. So one thing to note is that this makes this program pretty equitable, and it allows us to share costs. No one municipality is taking on the burden of hiring a full-time paramedic or paying for a $100,000 vehicle. By us sharing the cost and splitting it up, we are only paying for that smaller share, which again, in 2026, it's estimated to be around roughly 175. And if you want to go to the next one.
Okay.
And so what this will look like on a potential ballot question, for those who don't know, both the Village of Belgium and the Village of Fredonia are aiming for a referendum ask on the November ballot. The townships do not have to have a referendum. Instead, they hold what's called elector meetings, and they will increase their levy on an as-needed basis that way. But for us villages, we need to take a referendum question to the voters to allow us to increase our levy by the amount that we need to have. And so you'll see kind of that range of 175 to 200. Originally, we brought the board 3 different options. One was as high as 250. Next was 225, and the one after that was 200. The reason why we had that range is because while in 2026 our cost might be 175, we have to anticipate that inflation and hiring and firing and all those things are going to increase our costs over time. And so we need to make sure that whatever that amount of money is that we're going to ask, it's the right amount of money. So we don't have to be going to the taxpayers over and over and over again. So I'll give the village board a lot of credit. They certainly challenged the staff to keep things lean. And so that's why you see that ultimate ask that's going to come before you will be in that 175, 200K range. That guarantees that we'll have the funding we need in 2026 and gives us a little bit of wiggle room as well. So how that would impact your tax bills, you could take 200K would roughly equal about $70 per $100,000 of assessed value. So if you take the average home after the reval that just happened in the Village of Fredonia of $350,000, it equals to a tax increase of about $245 per year, or breaks down to $4.70 per week. One caveat I'll say is that even if you approve the referendum to go up to 200K, that doesn't mean that the village necessarily needs to claim all of that levy. So we have different ways that we can get creative with lowering jet levies and adjusting our assessed values, so that even if you say, well, you're allowed to get 200K, but next year while we have grant money, we only need 100K, we can actually offset that and only collect that 100K. So that we're not collecting money from the taxpayers that we don't need. And that's certainly a goal that village staff has and that the board has as well. I think I'll end it there, and Chief, I'll let you finish up.
Thank you. So again, as Christoph has said, the Village of Fredonia, the Village of Belgium are both going to be going to referendum in November of 2024. And then the Town of Fredonia and Town of Belgium, they have the ability to do an electors meeting at their annual budget meeting. They due to their population. They do not have to go through referendum. So that is all I've got. Yeah, for people that are from outside of the community here, I know Christoph had talked about the $70 per assessed value per 100,000 of assessed value. I threw some numbers together just for the Village of Belgium. They're about the same. They're at $70 per 100,000 for this program. The Town of Fredonia is $40 per 100,000, and the Town of Belgium is $40 per 100,000 is what it's estimated to be for costs for this program. Also, yeah, I guess another note that I had while Josh was talking, just for awareness, our paramedics that we have here are very seasoned and very skilled paramedics. They're not new kids to this business. Josh is probably, well, Crystal's probably the newest kid, right? And she's got 8+ years under her belt. Josh has 10, 12 years under his belt. And then we got Dean. 30+. So very seasoned people. Our residents are in good hands. That's all I've got. So,
Thank you, Chief. I appreciate that presentation, Josh, and everybody else that commented during the presentation. I think, yeah, now what I want to do is I'd like to open it up for questions, comments, really a discussion. So we're here for anything, to talk about anything, where we are, where we want to be, what we think we should be doing. At least there's 4 members of the village board up here. And as Christoph was saying, we came into this taking a look at the numbers that came in and the different possible referendum questions. And I know I don't just speak for myself, I speak for everybody here. First of all the village board members own homes in this community. So every single one of them is voting in essence for a tax on themselves, one way or another. But we do hold very close to our hearts, I guess, the fact that we do not want to just raise taxes just to raise taxes. None of us are interested in that. We have an assessment that we just went through. We have other things that are going on here, obviously, and there's other things that are going to be happening in the future here in the village as well. So when I say that, we've worked hard on this, I think all of us have had conversations and we've talked to our neighbors and things like that too. And is it perfect? Is it what we want to do necessarily? No, but we're faced with the situation that we have. And we have a really good program here, as is evidenced by the presentation and the discussion that the chief and others had. So again, we'd just like to sit here and listen and, hear people's comments and concerns and questions. And then obviously, I guess one thing that I didn't say at the beginning of this presentation and this whole meeting has been recorded too, and it will be on our YouTube channel. So as well as I think on Facebook, or is it just YouTube? Okay, so on YouTube. So anything that you heard here tonight you can go back over, you can take a listen to it again, share it with your friends, have a discussion amongst everybody that's in the community, because it's important to be not only educated and know what's going on, but really be able to speak to the different things that are happening. And really, when you go to that ballot in November, depending on what happens, to know what you're voting on and to understand the questions that are put in front of you. So with that, I'll shut up. And if there's any questions or comments or discussion, I would love to entertain anybody. Wally.
I have a question. You said cost, so that school bond referendum all at the same time here.
Hold on 1 second, Wally. I'm going to give you a mic because I want to make sure that we can all hear this on the recording. Now I feel like I'm on a talk show or something like Ricky Lake.
Question I have is this, it looks like we're at a crossroad here with the referendums coming up, with the school bonding referendum, and then we got this going on with the paramedics, and also probably with more tax increase there. I understand what a reassessment is. That was probably a good thing to do, to have that done, so we got that off our shoulder. But how do we address this? I would say, in my opinion there, the school board some members have contacted me. They were open about it. I do think we lack that on the paramedic system here. There has not been any phone calls that they would talk to me. My background is I started with the ambulance service here back, many years ago when I was on the village board. At that time, it was a very new, as you probably know, EMS service is only 50 years old. Fire service has been around a long time. At that time, people wanted it, and they bored through it on me because it was brought up to me to see what the citizens had to say. So we did our study. That lasted about 3 months to get the full facts. So we went for a grant and it ate there, so we knew what we were talking about. It became very, very obvious there that we had to do it. One correction should be made is when we served the northern part of Ozaukee County, by the way, that name was not discovered by me. That was discovered by people because we were serving that area. In addition, we took care of all of the village of Random Lake. It was a huge territory that we took care of. Now, what I did is this. People ask me, why don't you probably become an EMT? So did you know what's going on? I gave that some serious thought. I thought, yes, there's families we know of and so forth. So I took my training down at the Milwaukee Police and Fire Academy. This was in the very beginning, over 50 some years ago. I was rather shocked when I got in there. I thought, gee, what did I get myself into? it seemed like the fire service, they said, the chief made us come down here, but we're firefighters. So I think there's a distinction between firefighting, rescue, and I think at this time, the time has come, probably down the road, we should recognize the fire departments and the rescue. Then get the first responders there, and then get the EMS service. I think the EMS service, when you got 60% of your calls, medical related, has suffered. That needs to be a separate service there, so they can address their needs there and come together and serve the public, what we're designed to do.
Thank you, sir.
Thank you.
Just hold on to it, and if someone else wants to speak and.
Hi, Steve Burmish. I'm a village resident too.
Nice to meet you.
So, I mean, that's a good point. So when we're hiring, I noticed when we hired the paramedics, it's firefighter paramedic. Do we have to hire a firefighter paramedic? Because it seems like the value in them is their medical training. And it was incredible. You know, I actually think it's an awesome thing to have paramedic service in Fredonia. So moving forward, can we just look for just paramedics?
So yeah, I'll answer that one. So we run into trouble with state laws when we hire just paramedics. We are bound to 40 hours a week without overtime, or before we gotta do overtime. With firefighter paramedics, it's 24-hour shifts. We do 212 hours in a 28-day period without doing overtime. So it's a benefit to the village financially to hire the firefighter paramedics. Second piece of that is they're serving twofold. We are one department down there. We do fire and we do EMS. Everybody is trained to do both for the most part. So we are not only hurting with volunteers on the EMS side and the ambulance side of things, we are hurting on the fire side as well. There has been a lot of Band-Aids put on things in the most recent past, with the 3 fire chiefs here in the north end of county, myself, Jason Caswell from Wabica, Pat Wester from Belgium. We've done some things and collaborated together on the fire side as well, because the lack of volunteers is hurting on the fire side as well. We do simulcast pages, where if we get a fire call like this morning, we had a fire call at the lumberyard. Perfect example. All 3 departments were paged at the same time, and they all rolled trucks at the same time to get to that call. That is a piece that we put in place to help aid us using our volunteers without having to pay for more full-time people on the fire side of things. So, but firefighter medics, the big thing with that is the hours and the state laws that how you require. Because I was going to go down the path, Steve, and hire just advanced level EMTs, right? First, I wasn't really thinking about the paramedic side of things. Sheriff Johnson only wanted us to improve our response times. I'll just hire a couple A-level EMTs, but then I was bound to 40 hours. Anything over 40 hours, how many of those are you gonna have to hire to maintain 40 hours and keep the overtime down? Overtime costs on a budget, that's crazy. So I'm hoping that answers the question of why we went down the firefighter paramedic line. That is just the way it needs to be done based on.
It does.
Okay.
Another question is, are they gonna, if these referendums pass in Fredonia and Belgium and probably I thought you said the town of Fredonia as well?
Well, the town doesn't have to do a referendum. The town of Belgium and the town of Fredonia are just doing electors meeting.
Would it continue to be based in Fredonia?
Correct.
So we would have the greatest value of the paramedic service, just from distance.
Distance, yes. Yes.
And I think that can be seen on your slide where you had the response times. I mean, the village of Fredonia's response times have gone down more than all the other municipalities. Sorry, didn't mean to cut you
No,
off.
you're right. You're right on that. But yes, it is because those employees are the village employees. We are the only, we hire them, because we are a department of the village of Fredonia. So we are able to offer the Wisconsin retirement system and the benefits that way. Belgium Fire Department is a separate corporation. Wabica Fire Department is a separate corporation. we would have to pay different benefits that way. So Wisconsin retirement system, is the carrot that you hold out there for these guys.
One more question before I put the mic away. So then the numbers that were shown as far as the dollars that were required, did they include the cost per run? Considering now they have paramedic service. So I would think the cost of an ambulance run, if it's called out to somebody's, house, the insurance, has that increased to cover the extra cost of all of the training?
Correct. Well, the income you're saying, the revenue side?
Yes, so there's a revenue that the ambulance draws in, and hopefully that helps offset the cost to the village.
When we use a paramedic level skill, we are able to charge a paramedic level ambulance call to the resident or to the patient.
And that was figured into the numbers?
So I would say that the budget, the numbers that what we're talking about that 175 to 200,000. Again, if you look at it from a long-term budgetary perspective, the dollars that we have from the county don't expire until sometime in 2025. So when we look at the 175 to 200, and this is where it gets in the weeds a little bit, we don't necessarily, that whole number isn't necessarily needed until 2026, but there's ways that when we ramp up to full staffing, as was shown in the slides. But what the referendum would ask again is for that set amount, right? And then whatever we wouldn't use in those first years, say 2025, 2026, if we weren't fully staffed, we could offset with something called debt levy. So we could actually bring our debt levy down. So even though we're not necessarily using or needing all of those dollars at 200,000, we can bring the debt levy down by X amount to equal it out so that we're not overtaxing people just to have that extra money there, if that makes sense. I'm not the one to explain that whatsoever. I know we'll be doing some more of these meetings as well. We'll be having our treasurer here and Christoph will be back from Florida at some point, hopefully. So he'd be able to answer that more, but yes, those numbers include they include the revenues and things like that, and it's all in that process and in those budgets for those numbers.
And the revenues that'll be supporting this paramedic program are gonna be it's a percentage of the call. So let's just say that our base call is $1,000 and our paramedic level call is $1,500. That $500 piece of it is what's going to be offsetting that cost. We don't know what that number is yet. We don't have a long enough tally of time because we all know that our insurance companies are not very quick to pay bills. We can have procedures done and 2 years later, you're still receiving bills for it. So we will probably be back 2 years before we can start to see some of those revenues offset those expenses. But yes, there is so we would say 33% on that example of $1,000 and $1,500. We would say that 33% of our income then would go towards that.
And what you get back from insurance companies is not.
Yeah. I can, yeah, Josh is right. I can tell you that it's a $1,500 bill that you get, and the insurance company gives us $800.
No, the average is $400.
Yeah.
So for example, Port Washington, where I was, like about 1,500 calls a year, charged about 1,500 each call, got on average $400 per call, which is not $1,500. So, and they just, Medicare actually just increase what they get back, and it's still not what we need, it doesn't cover, we have expensive equipment. So if you have one patient, we use hundreds or thousands of dollars to equipment and medication.
So some calls, it's a negative loss.
Yeah, could be. Yep.
Carrie, did you have something? Yeah.
Like I said, I'm just here to take notes and report home to let my husband know how much this will cost, but mine is more of a comment as somebody with elderly parents in the town of Belgium and in-laws in town here or in the village. I just want to say that we've had numerous calls at my parents' house in the town, and we've had calls here in a village at my in-laws, and I just want to say that everyone that has responded to these calls, the amount of compassion from the members that have been here, it's amazing. So I really am all for anything that it will cost to have the service that we've had and the people that have been there. So that's really my only comment about any of this. It's just the people that are on those rigs when they show up and the compassion that they show for anything that has happened. And I mean, they're like on the spot. I mean, even just the ones that are not driving the rigs, the people that come in their personal cars, they are there within minutes. I mean, it helps that, you know, some of them work with my husband. So like, you know, one of them's there within 2 minutes right behind my husband, or, you know, so these are a great group of people, and I absolutely will support anything that they will need. And I will tell anybody who asks that I will support anything that they absolutely need for this department. So that's all I have to say.
Thank you.
Can I just ask a question? 2026,
You gotta speak.
You got to speak into the thing, sorry.
2026, you had 3 full-time.
3 full-time, 3 part-time.
Does that bring us to 100% covered?
That'll be 100% coverage, yes. And that was the 3 part-time are needed for the PTO or the paid time off that's out there in the sick time.
One thing, all these numbers are based on 4 municipalities being part of this, correct?
Correct.
And there is an out clause in that municipal agreement in 2028 that any one of the 4 with 60 days notice can leave the agreement, correct?
Yep.
So as the village hosting this in 2028, there is a possibility the village could be on the hook for more cost to the village residents if any one of the 4 municipalities back out. Correct?
Yes.
Okay. And with that being said, the other thing you've been talking about with this is you have an increased call volume. With an increased call volume comes increased depreciation on trucks, replacements, et cetera, et cetera. The budgets that were presented during the shared services thing, they took all the capital expenses out of that shared revenue agreement, correct? The replacement ambulance costs and.
There's no ambulance cost in this cost right here.
Correct,
There.
but the village is on the hook to buy the new ambulance
Yes.
at that point.
Yep.
Correct.
Yep.
So,
But that's what we would use the other revenues for, that, so that 66% that I was talking to Steve, 33% would go towards this program. This other 66% that we have would fund our paying our EMTs right now, the call per call piece that they get, and then
and the
helping
replacement costs on
replace that
yeah.
rate. The new
But that shortfall or difference between that 60% falls
Yep.
onto the village residents.
Yes.
So the village is in effect, we're the ones that are on the hook for anything that goes, you know, a transmission goes out, whatever.
You're on it now, right?
Well, we are,
Yeah.
correct, we're on it now, it's no different now. But the thing is, with all the additional call volumes, you know, they're only paying their share of what's there, so the village has a greater expense or greater exposure because of the fact that we now have paramedics on board than what we did before this agreement went into effect. And I guess the question being is we had the reassessment and the comments that were made on some of the Facebook pages, et cetera, and other conversations is that with that increased evaluation, the tax rate per 1,000 would go down. And here it is, we don't even know what that new tax rate is, and we're already asking for a referendum. How is the board and how is the advisory group going to counteract that sentiment within the community? Because you're putting it to a referendum in the November election, which is gonna be a high voter turnout based on a presidential thing. What's the response to questions like that as village residents, how is the board gonna ease the fact or make a difference if things go south or costs increase? Because replacement values in ambulances, you used to be able to buy them for, you know, it's like a car or anything else,
It's $400,000.
Yeah, 450 is what,
Yes, $400,000
Yeah.
per vehicle.
for 450, so. I guess I think we're locked into the agreement. The agreements are there, that's all been signed. The 3 other municipalities have an out.
So do we.
Right.
You do,
So do we.
yeah, you can let the paramedics go and you can go back to your AEMT levels. They're not going to do that, guys, just kidding. But.
Dean, I love you.
totally-
I love you too much, Dean. Sit down. Sit down, Dean.
He goes, no, but I guess, the thing is, yes, there's outs and stuff, but, I guess, we've got a lot of things from a village standpoint that are going to impact tax levies, this being one of several. You've got.
But you gotta also understand that we've been using volunteers for all of these years and it's been free for the most part, right? And at some point now we see that the volunteers aren't there anymore. I don't know what else to do, I'm throwing this out there when Sheriff Johnson came to me or came to the chiefs, I shouldn't say me, when it came to the chiefs, right? It was an opportunity for us to, hey, let's step back, let's take a look at this. This is an opportunity for us to start going down this path of what am I gonna do to replace the volunteers because they're not there.
Right.
We had a group of 8 kids, Fuzzy, that walked in 1996, right out of high school and stuck it out. I've got 6 of them still there today. Okay, so 1986, those guys are all 40-some years old. At what point are they gonna veer off and be done? But we don't have that big group of them coming through anymore. It's one here, one there, and they stick around for 6 months and kind of gone, maybe disappeared, right? Yeah. So it was my opportunity to say, how are we going to replace the volunteers? Okay, this is the way we need to get started. Not that I come here in 2025 or 2026 and say, my volunteers, I don't have anymore. I can't do ambulance service anymore. We can't do fire service anymore. Sorry. Got to find another solution. And then we're hit with holding the whole bag from the start of we need firefighters. I mean, I look at this program as a stepping stone because like I said before, it's not just the EMS side that's hurting, it's the fire side as well from volunteers. And this is sort of a stepping stone with the firefighter paramedics being in place of moving in that direction of what am I going to do to replace the firefighter side of things when volunteers there are down to nothing.
Right, well, it's no different than municipalities have, all kinds of expenses, they find a way to get other revenues, because Lockie County Highway Department's paving highways now to help offset some of the costs, or they brought the equipment in place. There's potential other revenues options for that. I mean, Oostburg Ambulance went to a private to do their ambulance,
Let's talk about that one though.
yeah. Well,
Let's talk about that one because there's some people here and maybe people online that don't know about that.
All right,
So Oostburg Ambulance went private. It was a municipal thing. It went private. So they went with, what's the agency? Orange Cross, right? But they were promised that they were gonna have full-time ambulance service. Now they only have it during certain hours of the day that they have an ambulance available to them. Otherwise, it's shuffling from Plymouth or from Sheboygan somewhere, right, Dean?
Absolutely, and they lost their brand new ambulance that was paid for by the village, that was given to Orange Cross for free. And then months later, after the fact, they wanted the village to support the staffing of that ambulance, and that ambulance is never there because they're doing inter-facility calls.
Yeah, so my point on that with the Oostburg Ambulance is the service level went from here to down here now. You don't have that response time. I seen something on social media the other day on Sheboygan Scanner, Oostburg Ambulance, CPR in progress, Oostburg Ambulance call, requesting because CPR was in progress. It took them over 20 minutes to get there.
sure. But again, these are the kind of, a great presentation here, but these other points need to be brought out as well, because those are you're gonna have people that get that perception of going, we had a reassessment, the perception was the mill rate was going to, lower taxes per se. And I agree. I mean, I had my parents aging in Waupaca at the time, and you're right. The volunteers that we have, the community is very grateful and should be very appreciative of that fact, because without them, there's a lot of things that would have transpired in this, that wouldn't transpire in this community because those people either A, wouldn't have made it to the hospital or whatever. You know, nobody on the planet's gonna make it off the planet alive, so I mean, you know, death is an eventuality for all of us. But I think you can do a lot to do it, but I think the thing that needs to be addressed are things such as, what are the options? Well, why don't we just hire them? But then we can bring up the Oosburg part of it, or other parts. There's a lot of things as villages and as that shared services group that really need to be addressed and brought up. And rather quickly, because we're less than 100 days away from the referendum. That's gonna have it stand a greater chance of getting passed, and I know it was brought up in the meetings that every referendum for fire and EMS, including in the county, passed in the spring. Well, in the spring, it's a different election. The electric you have in the fall is a much different one than what you have in spring election. So, you know, those kind of things, I just wanna make sure that those things are brought up. And that there's a way that the information can get out there regarding what the options are, you know, and what things that are out there. You know, presentation tonight was spot on. You brought in, you got everything that's what's there. But there's points that you're going to have to combat, because if it's not combated up front, you'll get the misinformation going around going, well, they said that their reassessment, my house went from X to X. And my taxes are going down, and here they are, it's not even, the tax bills aren't even out, they're coming for a referendum. And, you know, it's a
But
tough
that,
one.
yeah, but that's why I went in this presentation and said, this is nothing new. This is not something that just came up today or
Right.
within the last couple of weeks. This is something that's been ongoing for 4 years that we've been working on here. And then I believe, you know, the numbers for the assessments, that is like August 15th, right? We can get that information.
It's coming up pretty quick, yeah. We need all the levies and everything, and then,
You know, so, and again, depending on what those numbers come at, as we brought out in the service meeting, that could either increase it or decrease the ask for the referendum. You know.
I would say as far as between that 175 and 200, I don't think it's gonna change that ask much. I think it's just gonna be something that we've talked about as a village board too is, and again, worst case scenario, we've talked through this a little bit, but we all do have that out in 5 years, right? And so there's two possible scenarios that can happen with a referendum. One of them is you ask for X amount of dollars and continue them, right? It just keeps going to keep funding the program. The other is putting a time limit on it. And we've looked at both of those scenarios, right? Going, okay, is this program going to work? Is this going to be funded? Is this going to be something that our community is going to, you know, obviously really need going forward? So we have two possible scenarios in front of us that are kind of being crafted based on that. So when I say this is a listening session, it really is, because you've got decision makers in front of you that are listening to all this and hearing your words about, we have to be careful. And we've talked about that up here too, so many times, right? I mean, again, I can't stress this enough. We're taxing ourselves if we do this, right? And, you know, there's so many things, there's so many pots, pans in the fire, all that stuff, all the different analogies that you can say that are going on. And we recognize that. We understand that. And it's school referendums, it's wastewater treatment plants, it's sewer rates, all those things. And we have a delicate balance up here, but to your point, yeah, it has to be marketed correctly. And we recognize that that's a challenge that we face. But we also recognize the need for the service. I mean, I've told this story multiple times now, and I'm probably going to keep telling it. I apologize, but you know, my anniversary, December 27th, 2023, I went out for supper with my wife at the Chancery down in Mequon, and we're driving home. And all of a sudden I get a call from my Alexa at home, and I go, oh, that's interesting. Well, my children were at home with their babysitter, and the babysitter fell and hit her head on the concrete step in our garage, and she was bleeding. And, you know, my daughter, thankfully, she knew enough to call me right away. I said, you know, keep talking to your mom. I'm going to call 911. And I did talk to dispatch. And I want to say that you guys were there as soon as I got on the phone with dispatch. I think that they said it was within like 4 minutes, something like that. Now, thankfully, she was fine. Head wounds bleed a lot, right? But just to have that in my back pocket going, my kids were there. They knew enough to call me. We called and the service was there immediately. That's priceless, to your point. You know, my children could have witnessed something absolutely terrible that night, and they didn't have to because of the professionals that we have here. So while we do have a lot of things that we need to juggle, I think that we need to, you know, be mindful of everything that's going on, but then also be mindful of the service that's there. And I think that's our job, and, you know, that's the challenge that I give all of our members of the board, to take a look at this at a from a holistic approach and figure out what's best for the people that elected them. So, I guess that's all I have to say on that. And then you get the mic back there.
I have two things. One, I'm a mother of one of your volunteers, and I'm gonna tell you, you don't have those kids coming here to stay because they're leaving to become full-time firefighters somewhere else.
Yeah.
Right? So it's not that they don't want to be involved, but their lives are going to be dedicated to the service. Secondly, to back up, Carrie, I will do whatever we need to, and I'd like to know what you would like us as residents who fully support this, what we can do to get the word out and to make sure this passes.
You guys wanna?
Talk to your neighbors,
Mhm.
get on, you know, participate in the online forums, you know, get the truth out there. Anything that you learned here tonight, you know, share it with, those that are not here tonight or not joining us online, or not wanting to watch the YouTube, version of it. Just watch for the misinformation to come out and help us combat it, because you know it's gonna be there.
We'll be working with Michelle out of our office here to put together campaign stuff, flyers, social media posts that'll be coming out, with a lot of the information that you saw up here.
Yard signs?
I don't know, I'll talk to Christoph about that, yeah.
Yeah, I mean, the bottom line for me as a member, one, it's gonna cost money. So I understand people saying no, you know, it's more money. So if you want to say no, have that. But like I've said, we are highly skilled, highly experienced, very good at our jobs, and we're gonna provide very high level of care to our community. And that's the best. I'll put us up against anybody. And if it's a no, or if it falls through, I mean, at the risk of sounding maybe arrogant, there's 1,000 jobs waiting for me in a 20-mile radius. I mean, firefighter paramedics are in super high demand. I don't need this, you know, I love it. I love it here. It's my favorite job. And I want to serve this community for as long as possible. But at the end of the day, we're just blessed to have 3 paramedics. I mean, there are some services in the state of Wisconsin, I just learned, that have 3 members on their EMS departments. So to have 3 highly qualified paramedics is insane. So, I mean, when you're talking to people, it's just, you're getting the best and you're gonna have to pay for it.
Yeah.
That's just the bottom line.
And I would just, you know, going out on what you were asking us, what can you do? Again, as Rick had said, share the YouTubes, talk to your neighbors, things like that. If they have questions you can't answer, you can find all of our different information online. And that's one of the biggest, I think, misinformation things that's out there right now, is that we're either A, unapproachable, or B, we don't answer questions, we don't talk to our resident. It's so much further than, you know, from the truth. We try to be as open and transparent as possible. Just the fact that we have people in this room tonight makes me giddy, because it's so hard to get people in here. We've tried the electronic versions, we've tried putting it on social media, you know, tell your friends, whatever. And so many times nobody comes to a meeting, and then they all complain online about different things, right? We want to hear those complaints in person, or fine, social media is fine too, but come talk it out, because a lot of times the information that you get that's wrong is, again, as misinformation. It's meant to make you mad and meant to not want you to have to, you know, support the program. But if you could just get the truth sometimes, much like some of the things in the school referendums that have gone on as well, not going to get into that, but much like those things as well, you need to have the truth, and you need to know what you're voting on in November to make your decision correctly.
President, can I just jump in quick?
Yes, what? Nobody comes and talks to us.
Yeah. Yeah, it's very frustrating. And that's another thing, is on every single agenda that we have, the first and third Thursday of the month, there's a section, as Jessica's saying, for public comments. And we sit here and go, are there any public comments? And we always say so quickly, nope, there's nobody here. So let's keep going. we want people here. We want people coming and talking about that. We'll have other listening sessions that'll be going on. We've done some coffee with the village president and things like that. We'll continue to do those. We'll tie Chief Weicker in for things like that as well. But the biggest thing that if he's okay with that,
I'm not a coffee drinker, but.
what would you like?
Mountain Dew.
Mountain Dew with the chief. Yes, we could do that too. But the biggest thing again is get people out to the ballot that know what they're voting. Everybody should come out and vote, but know what you're voting on in November. And that's the single biggest thing that we can do is make sure that our citizens are informed as to what they're voting on.
Mr. President, could I jump in quick?
Oh, sure. Go ahead.
Hey there. I'll just tack on in regards to public participation. I believe that we have 2 meetings coming up very soon where you can help guide what that referendum question is going to be. And we alluded to it a little bit earlier regarding whether it's a short-term referendum ask or long-term. I would say if you're sitting in that audience and you believe in this program, then I would urge you to come to those public meetings and voice your opinion for whether you want a short-term funding mechanism or a long-term one. And if you foresee this program having value for the foreseeable future, then you can advocate that at a meeting. Just wanted to jump in.
So did you guys catch that at all? No? Yes?
He's got 2 public hearings on short and long term.
Yep. So there's meetings coming up right now, exactly like those referendums that I was talking about. There's a short-term one, there's a long-term one. Come comment because we need the input.
What is the difference between a short term and a long term commitment?
Yep. So again, probably the same dollar amount, right? Between the 175, 200, whatever it is. But knowing that there's that 5-year out, the gap, where we can get out of the program where you say, hey, we'll fund it through here. Now, fully knowing that if you fund it through, say, 2028, and this program is successful, we want to keep it going, guess what? We're coming right back in 2028 again to ask for more money because it doesn't get free after that, right? So is it, again, I guess the question is it more beneficial for us to ask for a referendum that goes through 2028? Or should we just ask for it and continue them and trust the program and that it'll work?
What I think that the thing that should be brought up is the fact that what is the village going to commit to? The village, obviously, the sentiment I get from what's in the room is we're going to commit to this program no matter what. It's part of our operating budget. If the other 3 municipalities say forget it, we're going to commit to this level. But if the question that's going to be put on the November ballot that has to be finalized by what, September 1? Is that the way it is?
Close, sooner than that.
So what is the board recommending for this referendum? What is the board's opinion on, is this a short-term commitment or is this a long-term commitment?
That's what we're discussing and what we need to know from the public. What is the public's ask, right? I mean, ultimately, we can look at it on both sides, right? But this is again where we need that public input. We need to know, does the public want us to run with this and say, yes, this is going to be something that we believe is going to be essential for our community for the next 10, 15, 20, 30 years? Or do they want us to be a little bit more conservative with it, go out for the beginning phase of it and see what happens? Both are, in my mind, both are acceptable, right? But you have to know, if you say, yes, we want the first one, well, this isn't going to be the last referendum that we're coming out for. 2028, if we're continuing on with the program, we're going to have to ask for it again. Also, look at these guys. Here we go.
Thanks, guys.
Thank you.
So I guess and Brian, maybe you can answer this. From a question being put to the electors, if you say we are going to commit long-term to this, you're going to get the people that adamantly support it are going to have that much more support for it. If you commit to a short term, the people that are opposed to it are probably going to say, all right, we got 2 years to figure it out. We might go that way with it.
I'm also worried about more of our going down our recruitment employees that we are going to have potential for 2026. I'm adding another full-time and I've got 2 part-time that are there. What am I going to be able to do to recruit that? So when we did the county money, it was said at that time that we were only going to be going to the end of 2025. If I wouldn't have known Josh Josh would potentially not be here. Because who's gonna come work for somebody that has that program out there? So that's a trouble that's the problem that I have with going to just to 2028. That's my personal opinion, okay? But if we commit to beyond, then we know that we're gonna get the best of the best coming here. You're not gonna get it's not gonna be a stepping stone, or it's not gonna be a young, no offense, Jen, it's not gonna be a young kid coming out of school that's gonna be here for 2 years, or be here for a year and gone, right?
Right.
To find another home. So.
And that's fair. That's really fair. And I think, you know, when we look at this too, something that's really frustrating about referendums that we learned, I think within the last week, you can't ask for individual amounts. You can't say, oh, we only need 50 grand next year, so we're gonna go out for 4 years, 50 grand 1 year, 36 for another year, something like that. You can't do it. You have to state a time and the amount you want, regardless of if you need that right away. That's how it has to be worded. So referendum questions suck. They just really do. They're bad. They're always badly worded, but to Chief's point, you know, that is a big decision that needs to be made for recruitment and things
The
too.
other thing that comes into play too is, you know, not only with the recruitment, but as you get, more of these positions and municipalities requiring these positions because the staffing levels are there, it's gonna become more commonplace throughout the area, and it's gonna be, I think if you have a commitment, it's gonna be easier to keep your
Absolutely.
full-time people, because as communities start to hire, what's the first thing you do when you find a quality employee? You pay them as much as you physically can, and sometimes you'll get those people that will go whatever, you know? So I think as a board, I think you need to say, where does our focus and where does our commitment lie? Are we going to give the fire department our backing with that long term? Or are we going to go and try to get enough short term and hopefully we can change it from there? I think being a 40+ year member that's been in EMS, and I live in here, I respond with a different department. I worked with Northern Ozaki for almost 20 years. I'm an honorary member at Fredonia. But I think if as a village board, don't commit to a long-term deal, I don't know how it's going to, I think you're gonna have a negative impact from the adamant supporters going, why won't the board commit long-term?
Right.
And it's going to be a difficult sell, but I think if you can, I think because the people that will vote short-term, because it gives 2 years to figure it out, there's a lot of moving pieces in this yet. That it could all come down to a, in 2028, when everybody can out, they may out, they may not, we don't know. But if the village commits to it, it'll also give the towns and the other participating municipalities the assurance that they're gonna have a service that's gonna be there, because, it's not like you're holding a hammer over them saying that, you vote for it or you're gonna lose your paramedic service in 2028, So there's a lot of pros and cons with both sides, but I think that the thing that, if I were the one that were in your shoes making these decisions, I think if you go with the long-term commitment, but you're going to have to really sell it, and you're gonna have counteract the points that, why we need it and everything else, and doing the response times, but it also sell it to the other municipalities, i.e. Village of Belgium, who's going to referendum at the same time, that we are committing long-term to this. It's not something, it'll help the Village of Belgium sell their referendum as well. So from the intercooperational agreement, that's what should have been discussed. And when we were at the last meeting, I brought this up, going, you guys are really going into this pretty quick. Is that the wisest move, or do you want to, and the reason given was that if it fails in fall, we can do it in spring. But once you have a strike against you, it's like when you're playing with the full count, you only got one more strike, and then it's gonna fall on the towns and the cooperative agreement to figure out how to fund this for 2 years before they go to a referendum again in the following fall.
And also remember, with this current agreement, as we were discussing last week in our meeting, if we don't pass this referendum, we are still on the hook until 2028 to pay this money,
Mhm.
pay the agreement.
We're still bound to it, yes.
Right.
Yes.
Just gotta find a
But
different
the
way to
tax-
fund it.
but the taxpayers who are voting are not bound to a tax increase. You guys have to work
Yes.
within your budgeted amounts. So you've got to come up within your budget,
And again,
that hundred, whatever thousand.
we're not gonna have money for our roads, we're not gonna have money for our parks, and that's.
Yeah, and
But you can't say tax, you
Right.
can't do a tax increase, you can go up to the levy limit.
Yeah.
So,
Well,
so
you-
you can't say you can't do a
but you
tax
can only
increase
go-
with it.
you can
We can
only
go to the
go
levy
so-
limit, we can go
you
to
can
the
go
levy
to the
limit
limit.
every single year.
And you
To
can
fund
limit,
this.
right, you can limit every year, but is that every year limit gonna be sufficient to fund the entire program? And especially when you get,
It's,
for
yeah,
example, the town of Fredonia, what the paramedic program is going to cost the town is equal to what the fire department charges for the entire public service budget. Without debt retirement, they have a huge debt retirement and stipend wage program that goes on top of it. So for the towns, it's gonna be even harder. But I think if you take and look at it from the commitment standpoint, it might be easier to sell it to the town referendums and to the villages, to the public taxpayers.
Sorry, we're having a discussion about the heat in the room right now. Everyone's a little warm.
I was trying to be in order to.
I see that, yes. Yeah, it might get a little loud. Yeah, yeah, right.
But,
Yeah.
Yeah, so remember that. Oh, boy. Yeah, let's rein this one in, guys. No, I appreciate those comments, so because, yeah, it definitely does make a difference, and you're right, it's a longer term commitment, helps with recruiting, it helps with, selling the program. It helps with committing to your fire department, it helps with committing to your citizens as well, right? I mean, this isn't just because you look at those volunteer numbers, as he's saying, they just keep going down and down and down. What happens when the volunteers are gone? See, in this. All right.
it's gonna be 2 paramedics here tonight.
Yeah, kidding.
16-month-old choking.
Yep. Conscious, not breathing. That's right here. So anyway, I think we can all see. All right.
Yeah.
Yeah. So I guess in conclusion to my comments, I would just say again that it is gonna take all of us talking about it and being able to spread the word as to why we need the program. I mean, in a lot of ways, this was perfect to see this happen. I mean, we've, right, as we were sitting here.
And just know that our social media is gonna start blowing up here with stuff. We're gonna
Yep.
go down that path.
Yep.
On the fire side of things, on the village side of things, to promote this and push this. Fred talked about the other municipalities potentially opting out. I don't wanna sound arrogant or not, but I don't know what other options they would have. I mean, everybody's hurting for volunteers, it's the north end of the county, it's not just the north end of the county, it's the entire country that is hurting for volunteers. It's what level of service do you want to provide for your residents, and what dollar amount do you want to put on that, right?
Right.
Collaboration is the only way that we can make it affordable for ourselves. Collaboration, if we don't collaborate on this, there is nobody that's gonna afford fire and EMS on their own, nobody. I looked at numbers and put numbers together years ago already, right when I became chief. We're talking over $1 million to support a full-time fire crew here, 24/7. That's 3 firefighters, 24/7. $1 million in salaries. That doesn't include equipment. I mean, there's no, Village of Fredonia is not gonna afford that, right?
Right.
That is outside of our scope, our means, but if we collaborate with the townships and the other municipalities up here, the other villages, there's opportunity. There's opportunity for us to get something, shore it up, make it good, and move forward.
Oh, you have something you want to say? You can stay seating.
Yep.
I would say continuity is one big thing.
Mhm.
I think the idea is people don't come to these, I understand that, some are afraid to. I have my philosophy when I went into politics there. By the way, I started listening to Central, took the chance, but going into politics there, I never made a campaign promise.
Mhm.
What it is, the Lord gave me 2 years, 1 month. I look at facts, what the world is going on, what's being talked about now, when it can contribute something to, that's when I talk. I want this week, you got leverage there, and you get respect. It needs to be heard. We have too much of that going on in our country. And if I can contribute 2%, 5% to be better, I'm a happy dude.
Yeah.
And then we don't need to do what's going on in Washington with these things. You're able to say there is something to be done. There's no question in my mind. All I can say is, school board, I think it's done a fantastic job. Government. I'm hoping that can happen here too, but I had people, they never return my call. So I think there's a gap here that needs to be closed. When people think of the people that have service, they think they're all the same type of people, they're not true. There's a difference between paramedics and we're squad. There's a difference when we make that squad. I've been on both sides of the fence. That is communication. I've been on that side also. And that is this communication thing. It's me. I've seen this night sometimes to make sure and hope that other people okay. Think that call. They want to okay. It's happening. I have to say this. Please get off and not getting off that. They've been very good for working. They're losing the first one on scene because their vehicle was rolling. They can put a canopy on it, so if they're not ready, it's unfortunate. So let's see if we can make that closer and work with people that have interest in help the next, even 2% credit. That's great. But at least you're supposed to benefit the citizens of the area and the reputation. That kind of inspired work, I think that's critical. We work at it. You may say why I have a passion for this. I'm not writing that, I will not vote on, but there's a reason for it. There's definitely a reason for it, and I explained it myself.
Thank you, Wally.
Yep, thank you, Wally. Wally, you spoke about our police department. They don't get the credit. The police department is very thankful that we have these guys here because they can get there quick and provide that life-saving abilities as those paramedics. Eric Leet, our new marshal here in the village, sent me an email the other day, and I have to, Josh, he was giving kudos to Josh, our paramedic, letting me know that Josh did some stuff at a call that was a pulseless non-breather, P&B, and Josh was involving the family in the decisions being made about that, the results of that patient, or what's going to happen with that patient. Eric Leet, the email said, I have never seen anything like that. The care, the personal touch that Josh had of walking into the other room, explaining to the family what's going on, what the lifestyle is going to be of this patient if we continue trying to do life-saving efforts if they come back. Josh includes that. I've seen that out of Josh. I've seen that out of Dean on calls, and it's a great thing that we've got a great crew right here right now. But yeah, Eric says all the time, it's so great to have your paramedics here to help out because they are the ones starting the CPR, right? They're the ones that are out there pushing the defib button a lot of times because we don't have the volunteers. The volunteers are coming from different communities, like I showed in that slide, coming from the town of Saukville, coming from the town of Fredonia to come into town, and it's longer response time. So yeah, good.
One other comment, I think you guys could use this in your marketing in your referendum is you never have a volunteer police department. You have to require a fire department to be volunteer. I think that point should be driven home and that should be put out there because we're requiring people to give a lot of time and a lot of energy and a lot of effort for little to no pay. And I think that has to be brought out is that you wouldn't go to a job and work for free. I mean, unless you're dependent, well, but you're not gonna work for free. Why are we requiring something as critical as life safety to be done for little to no pay? But yet we value it. Everybody says it's up here on the thing, but yet we're not willing to pay for that service. But yet we can go to Starbucks and spend $5 on a latte grande or whatever, I don't know, but whatever we can do. And we won't pay that for 24/7 coverage.
Right.
And, you know, I think this has a fighting chance to pass, but I think as a board and as a group, you know, with the other things, these type of points need to be brought out and need to be driven home, because if they're not, there's a very strong possibility that the two villages are not going to have a successful referendum, especially seeing as it was polled in November. It's too big of an electorate, and it's also an electorate that usually votes on emotion, not on facts. When your spring electorate is different.
And I believe we were told an opposite way. I know that Christoph had done some research on it. He was told that you have a better chance of passing in November on a presidential election year than you would otherwise, so. Yeah. Better.
Yeah, I was gonna say, I think it's either way. Do we have any comments online whatsoever? Anybody that's asked anything? Does anybody that's out there want to comment or pull anything in? I know that we've got a few people on. No? Okay. Are there any other comments from anybody else in the room that want to make one before we wrap this up for the night? Anybody else up here?
Thank you all for your time.
Thank you so much. Again, this will be on YouTube, so if anybody has any questions, share it out, but I can't stress enough. If nobody can answer your question, or if somebody asks something to you, you don't understand it, ask us.
Voicemail at the firehouse goes straight to my email,
Yep.
so, it's not that.
Right.
It doesn't go unanswered.
It's on our website.
Yep. Absolutely. And this is the first of many, so. All
Not
right,
just here, it'll be in the towns, and
Yep.
it's gonna be pretty much the same presentation. We'll
Right.
tweak it a little bit after some notes from tonight, but
Right.
it'll be in the town of Fredonia, the town of Belgium, the village of Belgium, so.
perfect. Thank you so much, everybody, for coming. Really do appreciate it.